Good. And I appreciate the church is having this seminar, especially because I tell a lot of my family's parents to take their children to churches and other places where they can get the social interaction because the child's behavior is so different that it's hard to get friends or the exposure they need. And church, we teach gospel and we also teach them how to love each other and understand. So it's a great way for them to learn that. And I have concerns from teachers say, I don't know how to manage this child's behavior because it's so different and it's hard to teach. So I think this kind of educational seminar hopefully will help you guys to understand and provide better services and teach the gospel through our classes. So I love your title, Wonderfully Made, and we are all special under God's eyes. And I would like to talk a little bit about autism, and as you know, it's a lifelong disorder. And the main problem with autism is how people with autism process information, engage socially, and communicate with others. So basically, that's the main hardcore of autism. That's where they have problem. So if someone has autism, have either one of these conditions, then it's not really autism. And it's a neurodevelopmental disorder. It's the brain development that is different than most of us, and has a wide spectrum of behaviors. So once again, it's social and communication deficit. We talk about deficit. And they have restricted and very repetitive pattern of behaviors, interests, and activities. So I'll explain more as we go along. But those are the two criteria that has to be present in someone in order to get the diagnosis of autism. And Dr. John mentioned 1 in 59. That's kind of few years back. Now they're talking about 1 in 44 children have the spectrum of autism. And in a Korean study, which is sad to see, but 1 in 38 children have the symptoms or meet the criteria for autism, which is sad. And in Korea, they focus so much on academic, and even preschoolers, 3, 4 years old, they go into academia and they learn about so much academic, they don't have time to play and develop their social skills. So might be one of the reasons, but it's really sad to see that. And as Pastor said, it's more common in boys than in girls. And based on this study, the numbers change a little bit, but in one reference showed that 2 out of 3 children on the spectrum have also intellectual deficit. That means they have problem learning academics and other skills too. And as I mentioned before, the key is social communication deficit. So some children don't talk, some children do talk, but they have problem communicating. And they have restricted area of interest and activities. So their focus is so narrow that that's the only thing they're interested in, or they have no interest in what other children in general will have interest in playing. So I'll explain more later too. And this is a persistent, it's not just maybe temporary, few months and then goes away, has to be persistent. And in social interaction, so social means when they're alone, they might look normal or they might not have problem. But when in a family setting, school, friendship, job, or in a leisure setting, that's when you see that they have problems. So it has to be persistent and in those social settings and interaction. And has to be in different contexts and settings. So someone got a lot of therapy and they look so normal that people think, does he really have autism? But that child in a different setting, let's say at home got so much therapy, or with the ABA therapist, he's really listening, doing everything he's supposed to do, but when he's with mom, he's a completely different child. Or at school, teachers say he's a perfect child, but then in a playground, he's not. So the same child might be different in different settings. So it has to be in more than one setting that the child has deficit. And then symptom has to be present the first 3 years of life. That means that someone who was perfectly normal all of a sudden start having problem in social communication and act differently as an adult or teenage. That's not really autism. Has to be present early years. Some people don't recognize, especially those who are higher functioning. We talk about spectrum. Those are who are really high functioning. They really, the symptoms are not apparent in the first 3 years. So, but then when we do careful interview and review documents, and then we can find, yeah, the problem was there. And some babies, even they have in the first year of life, and we'll give more examples about that. So these are the key aspects of why someone, or how we call it autism. So autism is nothing. The diagnosis is clinical, and by history and by seeing the child's behavior. There's not a blood test or MRI or any test that can say, oh yeah, you have it or not. But we do testing because there's what's called comorbid conditions that it's higher chance of someone having autism. So that's why they do MRI, because sometimes they have brain malformation, or we do chromosome genetic testing because that can be associated with autism, but it's not the diagnostic criteria. So diagnosis is clinical, so it's by observation and history. So we talk about social communication. So social, is not when I'm alone, but it's with somebody else. And communication when I'm interacting and communication is like two ways. And communication, like Pastor John says, like verbal and nonverbal. So verbal, like we all know, if I'm talking, you guys are listening, and you know what I'm trying to say. And sometimes you guys respond, and I kind of listen and respond. So there's a back and forth. We call it reciprocal. We are sharing ideas or meanings through verbal communication. And verbal communication can be also like not just talking, but it could be text. And also the way I say, if I'm really angry, my intonation might be different. I might be shouting, and if I'm happy, I'll be like singing tone. So there's a lot more than just words that we communicate verbally. And nonverbal is all the other things like body posture. If I'm really like anxious, I started shaking, or I have different, like body movements that I don't control it, but it's part of my way of telling others. And people who are looking at it also understand, oh yeah, that person, no, something's not right, maybe it's frightened, or maybe it's scared, or whatever. So that's where communicating non-verbally, we usually don't think much about non-verbal, it just happens that we know. It's like kind of we learn as we go. But so that's non-verbal. And in a social interaction, we do have exchange, or we kind of share our feelings and emotions. So that's what's called a social communication. And in autism, so there's deficit in nonverbal communicative behaviors used for social interaction. So some of the behaviors, it doesn't really match what's happening. I'll explain more about it later. And also, like, it's impeding relationship with others. So it's a group of children having fun and playing. They don't know how to engage with them, and they rather be outside. And they don't know how to maintain a relationship, like kind of how to engage with them playing. So a lot of time, a lot of preschooler, they engage in parallel play, right? They're all playing cards, or they're all playing, like a tea party. But they're not interacting. Like a child with autism will be on the side doing the same motions or play, but not really engaging with others. It's not a joint play. All right. And then social emotional reciprocity. So we talk about personal space, and also like back and forth conversation. So someone who has autism, some of them have language delay. And so, but okay, before I go that, let me explain a little bit about spectrum. So we talk about deficit and has like, and deficit like someone who doesn't talk, like a mute person who is not autistic, doesn't talk but also is communicating, right? And someone who's talking a lot, might be talking a lot, can really recite a paragraph or really give a whole talk, but not really communicating. So it's a spectrum, and what is important is we are interacting, going back and forth. And it's a conversation. So someone who is really an autistic child who is really delayed or like nonverbal, they're not communicating at all. They're not even saying any words. And then someone who is high functioning, who is talking a lot, and sometimes they're like professional, like professors who has this diagnosed autism, they talk a lot. But it's hard to have a conversation with them because they like to talk what they want to do, or they are the one talking, and you have to listen, and you try to have a conversation, and they tend to go whatever they want to say. So it's a whole spectrum that we're talking about. So it's back and forth is very important. Like, and then it's about sharing interests. Like if you're in a group and they're all talking about what they want to talk, but never give you a chance to talk, you get bored and you don't want to be there, right? So there have to be some sharing of ideas and interests, and that's what's difficult for people with autism. They make friends based on their interests and not because they like the friend. And same for affect, like they have hard time understanding what's going around them. So like they might be singing in places that are not appropriate. Let's say in a funeral, everybody's sad, but then this child have no idea, will be singing and acting different, like if he doesn't care. But it's not that he doesn't care, he doesn't understand what's appropriate or not, or vice versa. On a birthday party, instead of joining everybody and seeing what's happening with the opening gift and eating cake or whatever, they rather be on a corner and cry or be by themselves. So that's the lack of social emotional reciprocity. And the other thing is abnormal response or total lack of initiation of social interaction. So social interaction, from a developmental point of view, babies learn to do that without us teaching them. Like if you see a 6-month-old or 3-month-old baby in a stroller and you say, "Hi, it's so cute," and then they smile back at us. And sometimes they want you to look at them and they initiate the interaction. So that's normal development that we don't teach, but somehow baby learns throughout the years. But in people with autism, it's something that they don't do it. Like father might be coming from work and trying to say, "Hi, I'm back," and he keep playing without looking at that. Or someone say hi, and instead of smiling back, they'll just cry and scream. And if they go to a place where there's a lot of children playing, they don't go and say hi. And if someone approaches them, they might cry and then stay away. So it's the abnormal response to social interaction. So this is and I like cartoons because kind of very simple, but starts very early. If we look at the bottom, the baby is crying and doesn't care if mom comes to him, and he doesn't try to engage with parents, or when mom tries to hold him, the baby might be crying or might resist to be held. And sometimes parents think he's the easiest baby because he's so happy when he's by himself. And when someone tries to hold, he cries, so okay, leave him alone. And so, or they cry too much, and they calm down when they're by themselves. And we are humans, we are social human beings. We like to be with people, we like to be recognized, we like to be praised, we like to have fun with others, and children love to have friends. But someone with autism, they don't like that. And they might be doing well by themselves, but when there's others, they get upset and they cry and they go to a corner. And it's very hard for parents to take the child out because he will have such a meltdown in a public place that they rather not go and just stay home. Okay. Okay. So we talk about nonverbal communicative behavior for social interaction. So we talk about eye contact, and you guys did a little game with eye contact. Eye contact is something that starts when they're babies. Even babies, soon after they're born, a few weeks, they started making eye contact. The eye contact, they don't see it clearly, but they try to look for somebody's face, and they look at their eyes, and they start having facial imitation. So that's a typical development that we don't teach, but it happens. That's why we have milestones. So, 3 months, they have social smile. So someone who is 3 months, they will smile and laugh at everything. That's very cute. And that's the milestone. The brain's developing, and certain part of the brain will develop that. But people with autism, the eye contact is not there, or is very different. So some babies will not look at it, and when you try to force, it's very uncomfortable and they cry, or they may be avoiding it and look somewhere else. And as they grow, that could be true too. And when you're talking to someone, they might be looking down or might be looking on the side. Or sometimes a teacher is teaching to the class and this child is doing something else and not paying attention to the class. So eye contact is part of communication. With someone call your name, you turn around to say who is calling me. So that's, we are using it without thinking. That's part of communication. And that's where people with autism will have difficulty. With therapy, and if we start early, eye contact gets better, and some children learn to make eye contact, but still the natural, spontaneous way of communicating through our eyes is not quite there. But they might look through normal, and sometimes you could, it's very hard for them to maintain eye contact. And sometimes I say, okay, imagine you have a sticker on somebody else's forehead. So look at the sticker, or pretend that there's a sticker there. Then it may look like they're making eye contact. So there's things, and they learn and they practice, and they look pretty typical. And also for body language, as I said before, we communicate through our body language, and our posture tells a lot. But people with autism don't have that, and their facial expressions are very limited. Sometimes they are the perfect; they look so good. But if you look carefully, they don't have a lot of emotions. They don't communicate much. And also they have problem understanding and the use of nonverbal communication. So if somebody's mad, they don't it's kind of breathing hard and ready to punch. But a child with autism might not even know what that means, and might keep doing stuff that will make the other person mad because he doesn't really read the body language. And also that not only he doesn't have facial expressions or body language, but also has difficulty understanding other people's facial expressions and body language. Recently, Korea had that drama, Attorney Woo, right? Yeah, so I think they did a pretty good job in describing some of the symptoms. She's someone we call it high functioning. She has a job, she's super smart, has exceptional memory. So those are some of the characteristics of autism. But then, at some point shows all the different picture of his dad with different expression and what that means. So it's in a way kind of, that's what they have to learn. It doesn't come natural. So we talk about nonverbal communication. I mentioned about facial expression, body language, intonation of the voice. This is very important. Like we do it, and no one taught me how to say, how to my voice change, right? When I'm anxious, I'm kind of a little bit anxious now. I feel I'm talking alone, but like it's something that we do it without learning, and some actors, they train themselves to change it, but for most of us, our voice intonation change. We're happy, we're sad, or we're angry, right? But people with autism is something that they have deficit, or they don't have it. And also they don't understand what that means. And also talk about personal space and body distance. So sometimes they have problem because they are too close to somebody else, and the other friends say, get away from me, but they don't get it, and he thinks that he's playing, and they will do more, and you kind of, no, leave me alone. So those are the some of the body language that they don't know. So you have to be concrete. So teachers are very good at using examples, and they say, okay, stay at arm reach, right? So that's the distance you should be keeping. In a way, they have to have more concrete example of what that means, personal space. And I think what's very important is because they don't learn naturally. They learn through practice and through role modeling. So we have to show them how to do it right way, and a lot of practice, they will do it. So if we do it the wrong way, but then we tell them how to do the right, they don't get it. And so sometimes, you have to have a pretend or role play game and show how to do the right, Okay. How is everybody doing so far? Is it clear? It sounds like a lot of repetition, but I'm trying to go step by kind of each item separately, and then I'm kind of getting nervous. Okay. Any questions so far? No. Okay. Okay, so the other thing is develop and maintain a relationship which is appropriate to the developmental level. So a 2-year-old, you don't expect to behave like a 5 or 10-year-old like an adult. And 2-year-old, they're supposed to be playing and having friends like a 2-year-old. So when we see someone with autism, we have to look at their development level and what is appropriate or not. And also different context, and also making friends without, okay, so let me go back, okay. If someone, if child with autism has received a lot of ABA or speech, ABA is behavior therapy. That's one of the main therapy to help change their behavior. And speech is to teach them how to talk and communicate. And sometimes they will teach them how to play. And we teach them imaginative play because that's, they have hard time understanding what's reality and not, or imaginative play. So they are very concrete. So we teach them how to play imaginative games like tea party, right? You have toys, and we teach them how to play, pour tea, drink from a cup, pretend you are eating cake, or you pretend you are cooking. So that's an imaginative play or pretend play that someone with autism will have really hard time learning. Children typically developing, they learn that without us teaching. 2-year-old, they're very good at imaginative play, but someone with autism, they really have hard time understanding. So the therapists, when they work with them, we have to teach them, all right, let's pretend we are eating, and let's pretend pouring. So we teach them, and they practice, and also they teach them how to say the correct way, and they teach words. So that's one of the tools that speech therapy or behavior therapy will use it. And someone with autism, they will eventually learn, but it requires a lot more practice than a typical child. So someone who has speech delay, you teach them a few times and they get it, and they will learn. But someone with autism, they have to practice like 100 times or even more, and they will learn, because the way they learn is different, but they will learn. And so, as I said before, with the therapists, they learn how to do certain routines or play, and they look normal. They look like, oh my God, that child has imaginative play. Oh, that's great. But then when the child is supposed to play with other children, they don't know how to play the same game. Am I making sense? This is harder than I thought. So, autism is something that we can teach, but doesn't generalize across settings. So if they know how to play with the therapist, they look normal, but when with mom or with friends, they don't know how to do the same game, right? So what you have to do is do the same practice in a different setting, and they learn eventually. And it takes longer, like a lot more practice. So a lot of misconception is that, sometimes they think that they are not listening, or they don't want to do it, or they don't want to participate. You know he knows how to do it, but he doesn't. It's because the setting might be different. So for him, it's completely different task and skill. And so we call it generalization of learned skill. So if you know how to do one task, you know how to do that task, and you'll do it in whatever setting. But someone with autism, each task is linked to that setting, and might really have a hard time generalizing it to a different setting. So sometimes you might feel like, oh my God, I told him he knows how to do this, and now it's like he doesn't want to do it. And it's not the case. Might be that you have to practice that in a different way, in a different setting. Okay. And a lot of times people get frustrated because you go over and over, teach them, seems like you're not making progress. It's just the way they learn. Unless it's something they're really interested, and they learn without you teaching anything, and they're so good at finding, and then they're so super smart, look genius, and you feel like you don't know anything about it. Unless it's their area of interest, the rest of the stuff is very hard for them to learn. And it's like we have to repeat. And do it over. And a lot of times parents come and they're like so tired because it seems like the child is not making progress. And I say, okay, if you did it 20 times, maybe you need to do 100 times. And then eventually the child will learn. But it's a lot of practice and repetition. All right, and we can teach the child to make friends and have pretend play, or what is appropriate to that age. But even they know how to play, they have a hard time making friends or keeping friends. And it's because whatever they learn is we teach them how to play. But in real life, not everything is the same, right? And especially children, typically developing children, they're very creative. They don't like routine. They don't like the same thing over. They get bored easily, and they always want to learn something new. So those kind of children, when they're playing with someone with autism, that they don't learn quickly, and they always want to do the same thing, it's hard to make friends. So that's where it's very hard for them to make friends. But But if they're all like Pokemon, or they like, like they have dinosaur interest or whatever interest, they will be talking about it, and they really do well. But besides that, they're like, oh, who are you? And then they each will go their way. So what we think about autism is really, does he know how to make friends outside of that specific area of interest? I mention this because a lot of times parents, when they come for assessment, they see their child and they have questions about does he have autism or not. But then they see all the things that he does that appears to be normal, that is not part of autism, but yet he has problem making friends, he has problem at school, and he is kind of very stubborn. And when I have to ask questions very specifically. Okay. Okay. So we talk about pragmatics, and how many knows about the meaning of pragmatics? Okay. So, okay, one hand in the back. Okay. So, here is the social language skills that we use in our daily interaction with others. So they include what we say, how we say it, and how our body language, and whether it's appropriate or not to the given situation. So look at the environment and how we are using it. That's called a pragmatic, language pragmatic. I mentioned before, like if it's appropriate to say, I'm so excited, I cannot wait to go, eat cake. It's appropriate in a setting, but might not be appropriate in a different setting. And how I say it might be also affecting that. Okay. Oh my God. All right. So, like, it's also interpreting what other people are saying and acting. And people with autism really have a hard time understanding that. And they're very concrete thinkers. They don't understand joke. You are saying something funny, laughing, or something kind of mean, but in a laughing way. That person is joking, and it's supposed to make others laugh and have fun. But people with autism, sometimes they get really upset because they say, how can you call me that, whatever. And all of a sudden they get really upset and, you wonder, what's going on? That's it's part of the pragmatic that they don't have it. And sometimes they say things that are really awkward in that setting, but might be appropriate if it's, in a written form or in a different format. Okay, so example pragmatic is like conversation skills, asking, giving, or responding for information, turn taking. They're not very good at taking turns, and they always like to talk over and over. Like if you don't understand, asking for clarification, like someone doesn't know, you say, okay, what do you mean? Or am I understand correctly? But they don't have that. Adjusting language based on situation. And humor is very hard, and jokes, they might get really upset. Okay, let's see. You guys are such a great audience and quiet. I usually like this to be more interactive, and like all of a sudden I feel like, oh my God, I'm not sure, I kind of lost. All right, so I think, I know there's an, where am I? Okay. Okay. All right, so away from social communication, the other criteria for autism is like restricted, repetitive pattern behavior, interests, and activities. So you have to have, well, like for a diagnosis, it has to have more than 2 in either category. And like the speech, motor movements, and use of objects, they are very like stereotypical, we call it unusual, or repetitive. And like we almost should repeat the question instead of answering first. So kind of repeat, or sometimes they have special word, and we call it echolalia. They kind of repeat instead of answering, like say, 밥 뭐 먹을래? And say, instead of saying whatever, say, 밥 뭐 먹을래? Or say, what do you want? And you say, what do you want? And also instead say, are you happy? And you say yes or no. Or instead of using I'm happy, you say you are happy. Kind of is repeating the same question, or they're using third person instead of first person in answering questions. Also, the body movements like hand flapping. Everybody knows they like do hand flapping, but also they can do spinning, and they can do weird like hand movements, and it's part of their stereotypical repetitive movement. And the other thing is routines, rituals. Like they are very rigid, and like they don't like changes, so they always have to be the same way, or if not, it's very hard to work with them. And some children will walk in a certain pattern, and if you try, okay, don't do that, they'll have a behavior meltdown. And resistance to change, like they mentioned before, like routine is really good. And I have children that instead of the teacher, a substitute teacher comes that day, will have a behavior meltdown and cannot attend the class. So because they don't do well with changes, even they're small. And sometimes I tell parents that before the school year starts, go to the school. If you have a chance, meet with the new teacher, let the child know that will be the new school year, so they get prepared to that change, because otherwise too hard for them on the first day. And highly restricted, fixated interests that are abnormal intensity of focus. So some of them might really like Lego for a while, like Lego, they will be interested in Lego. Or dinosaurs, little ones, like 3-4-year-old, they will know all the names of dinosaurs because that's their area of interest. Or stars, or like some of them will fixate at numbers. And they're very intense. It's not that, I'm interested in certain things, but it's they will 꽂혔다고, they'll really go deep into that. But also some children, sometimes they don't have interest in what other children his age will have interest, like toys. They will not play with toys. They will not play what other children would play for that age, but they will only focus on abnormal things. And sensory input, it could be either way. It could be they're very sensitive to noise, smell, light, sound, touch. They really may have a behavior meltdown, crying. Right? You can even lose the child because it's so like they will not tolerate like like barefoot on the sand. They will have a meltdown. Or could be the other way around, that they not respond to sound, or even when you are calling their name. So you call their name 10 times and they're kind of not hearing, but the hearing is good. Or they like to kind of do things to feel that input, like jumping or going into like other people, or like wall, and to feel that impact. Or they will be looking at the ceiling light, or light like really intensely. So it could be either way. Could be either extreme, that they have unusual response or interest in sensory aspects. So there are some examples, like what is stereotypic or repetitive speech motor movements, like spinning objects, doing hands, repeating words, using objects in a repetitive way, or using phrases. My friend son, he was around 2 when his mom was concerned about language delay. And first she thought that he was super smart because he really loved to look at the labels on bottles and whatever, really small letters, and really pay attention to that for a long time, but he would not talk. And then later it was that he has autism. So they might have interest that you think, oh my God, a lot of parents think, oh my, he's genius. He knows, how to count, or he knows letters, alphabet. But then doesn't communicate simple things, like doesn't say mom or dad or I want water, or doesn't respond yes or no, but they will have very unusual and very fixated. Or some children might even have long sentences, or they might talk like a little professor, like really hard word, 4-year-old talking about this, I don't even know the name, and describing it. So wow. But then when how are you doing? What do you like to do? What did you do today? Do you like to play with friends? Has hard time with open-ended questions. Okay. And we saw about rituals, routines, same thing, motor ritual. They have to do certain things certain way, otherwise they get really stressed. Insist on same food or routine. They like to eat the same thing over and over, and they don't like changes. And parents say, oh, he's so picky eater, and it's very common to have that. It's like trying new food is really hard. So, sometimes they only eat chicken nuggets or French fries or hamburger, and that's it. And then sometimes they love to ask questions over and over and over. You just told them the answer, and they'll keep coming like, when we'll go home, or when we'll go vacation, or, kind of 10, 20 times, and they'll come. Or there's little change in the routine, and that's when they really have meltdown and really hard. Sometimes parents, I tell mom to prepare, and sometimes they do 1 month before. If they have a trip or a change, they have to tell them 1 month before. And I have another mom that if their substitute teacher coming, she asks them school, and then she will tell them, okay, remember that day, there will be a new teacher coming. So that will help the child prepare. And also we talk about restricted, very unusual interests. They do a lot of strange things, and they'll be spending hours and hours looking at the ceiling light, or they will be they have a favorite blanket that has to go everywhere. If not, I'll have behavior meltdown, or they will be eating things that are not food, everything to their mouth, or lining up toys, cars, cans, all kind of objects. But that's his way of playing, instead of playing with toys the way they're meant to. And it's very persistent and perseverative, and it's very intense. And we talk about hypo or hyperactivity, the response to pain, sound, heat, cold is different. So some children, for nothing, they will cry like it's the end of the world. Some children, there will be cuts, and he's bleeding, and he's walking if nothing happened. Some children will be really sensitive to cold. I have a mom who he missed school so much because in the morning he's so cold. So we went through a lot of different options. Maybe he can sleep with his school clothes ready at night and go to school the next morning. So all kind of different things, because his response to cold is so bad that he will even miss school. Or vice versa. They will go with shorts in the winter. And here it's not that cold, but in other places where it's snowing and the child goes in shorts to school, that's not, that could be dangerous. But so that's how, they have different response. And also we talk about sounds. Some children are very sensitive to sound. Like I was in clinic, and one of the clinic location had a far away rail truck. Once in a while something coming, and no one pays attention, but the child all of a sudden say, oh, there's a train coming. So things like that, for us, we don't perceive, but for a child it could be very, can hear everything, or little sound can really make him upset. It could be either way. Or they like to smell everything, and it's not only food, but they will smell everything that is there, kind of go and smell. Or touch, they like to explore everything by touching, and could be inappropriate too. We talk about lights and spinning objects. The haircut is very common for parents to say, oh my God, I cannot do a haircut with him because he thinks I'm hurting him. Or sometimes even bathing could be really hard. I have a child who he was around 5 when I started seeing him, and mom has to watch him when he goes to bathroom because after he's done, he likes to play with the poop and smell it, and sometimes smell the wall. And so mom watches every time, and then it sounds like he stopped doing it, and then when he was around 8, 9, he did it again. So that kind of, you never know, but that's a persistent issue. Okay, so in general, when someone has autism, we try to help, and with intervention, they do get better. That's why I think early intervention is very important. Early identification is important because brain is developing fast in the first few years of life, so whatever we do is much easier to teach them than later in life. And the goal of therapy is to increase communication skills. Some children don't talk, don't make sound, and we teach them. One of my coworkers' son has autism, and she told me he didn't talk until he was 5. He got diagnosed, he got tons of speech therapy, and then he was in high school, and mom said, oh my God, he talks so much, I cannot make him stop. So that could be a problem too, but with therapy, they do get better. Also, they have self-stimming behavior. A lot of those repetitive, unusual movements could be self-stimming, means that they're anxious and they're doing it to relieve stress. And sometimes they do it because they are bored. So, and it's not appropriate, right? Or they do things that are, like some children like to touch their private parts and it doesn't look good. So we teach them to even decrease those or do it in places that are more appropriate. So kind of teach them, depends on the child. We can give instructions and help them decrease that. And also increase social interaction. This is important because we want them to have an adult life. And part of the adult life is to have friends, job, and how to interact with others. So we want to teach them how to do it appropriately. So we are that will be one of the goals. And also, a lot of children are aggressive, verbally and also physically, and you cannot work with a child. So therapists will work on finding ways to decrease that behavior, and also maladaptive behavior and inappropriate behaviors. That will be one of the goals. And increase flexibility. They're very rigid. They always want to do the same way, no matter what. But it's not appropriate. So we have to teach them, okay, let's do it differently. And one of the patient I have, he loved to win. All the game he has to win. So if he loses, it's a tantrum, really behavior meltdown. So one of the goals is for him to learn to lose, but we cannot say, okay, it's okay to lose because he doesn't understand, he has to win. So they will do like role playing, they take turns and family game. And one time mom loses, oh, I lost, oh, it's okay. And then the brother will do the same and kind of teach him to be flexible. And also decrease hyperactivity. A lot of children with autism, they're hyperactive, but also can have hyperactivity, ADHD along with them. So we want to teach to kind of decrease that behavior and also increase focus and attention. So those are some of the goals that is needed. And this is in general, all behaviors at communication. You as a teacher, child, not only someone with autism, as you know, they have a lot of behavior because of their diagnosis. But also other children, sometimes they misbehave, and it's a way for them to communicate where they are. So understanding where the behavior is coming. Also sensory processing might play. Tactile, visual, like if a small crowded room with 20 children, that will make everybody uncomfortable. So take that into account. Could be overstimulation or understimulation too, like after eating lunch and I'm talking too slowly and really boring or make everybody sleepy. So could be an example. And also individual and temperament differences can play a role. Not everyone responds to the same way. You are teaching the same way, but each child will respond differently because of their difference. And also, is that a familiar environment versus a novel or new environment or a change that will make the behavior of the child different that day. As you know, mentioned, children with autism will have higher behavior problem than typical. Is part of their condition. And also a lot of children with autism will have health problems that are higher than a typical children. A lot of them will have seizure disorder. And you know, if they have a seizure, the brain is not, after the seizure, brain is in a stage that may be more irritable or cranky, or they may act differently. So if they have seizure has to be under control the best way. If they're sick that day, will change their behavior. A lot of children with autism also have a lot of sleep problems. They will not sleep well, or they will wake up in the middle of the night and they will play, wander around, and then the next day, of course, the behavior will be worse. And GI issues, gastrointestinal, so very common. A lot of them will have problem with constipation or with indigestion and diarrhea. And of course, if you have GI issues, you are not on your best condition to attend class, and that will also impact the behavior. And a lot of emotional disturbances, like people with the spectrum or also children with developmental disability will have higher incidence of emotional problem or mental problem than typical peers. So they can have anxiety on top of their autism. They can have fears, panic, or obsessive compulsive. They already have those traits, but then if they have obsessive compulsive on top of that, it makes it even harder. And also ADHD is very common to have in people with autism. And also stereotypic behavior, some behavior that are like, what is doing it? But maybe it's part of their autism versus all the other stuff. Or maybe, sometimes hard to know what is what. It could be their autistic behavior or is really having a bad day and that's why he's acting like that. Okay, I think I'm all right. Okay, I think this will be my last. So common behavior problems. I don't know how many you have experienced, but could be very irritable, tantrum, poor frustration tolerance. Anything will make them mad. You cannot even talk. Even if you praise them, you'll get mad. like, you say, "Oh, good job," and say, "Don't talk to me." Poor transition, okay, let's stop doing this, let's do something else, or let's go out, like transition from one activity to another, or one place to another. They really have a hard time. They will have meltdown. You don't know what's wrong with you. You like to play outside, but then the transition might be hard. Poor attention, they're easily distracted, hyperactive, eloping. A lot of times they just run off, get out the classroom and run. Then you have to chase. Wandering, they love to go around wandering class instead of sitting down, or climbing in places that are not appropriate and dangerous. There could be aggression, verbal, nonverbal, to self. Sometimes they injure themselves, they pick, they bite to self, and also they do to others. And they're non-compliant, they don't listen. You say, okay, let's open page 1, and they will not do it. Or they're defiant, or oppositional. They do the opposite of what you're telling them. They also disrupt class and bother other students. They're very rigid with routines, anxiety, excessive fear, avoidance. They don't like to do certain things he's supposed to do. And they have no interest or very poor social interaction, and they don't respect authority. They don't know you are the teacher, you are the principal, you're supposed to listen, right? At least you're supposed to respect. They don't understand that. Okay. All right. I'm sorry if I make you sleepy. I hope this was informational. Any questions yet?
So in the church setting, what would be your number one or two top advice in dealing with children with autism or anything that they have autism?
So, could you repeat that question?
Right. So obviously we're not therapists, right? So we don't have a lot of time with these children, right? And so the question is there like one or two, advice you can give us in how to deal with them? Should we be stern with them? Should we just let them do what they want to do? Like what would you like for us to do with children who we think has autism?
That's a very good question. I didn't go too much into behavior because I think the speaker after me, was mentioned before too. This is a lot for teachers. You are behavior and you have to teach other students as well how to handle these children, right? But I think one is kind of, at least I'm hoping that after my talk you have a better understanding of what the behavior of the child with autism. So, I have some slide of things not to do. I'm not sure if I so can we have the, I have two slides on what does work and what doesn't work. Okay, so one is reinforcement. If you see a child doing good behavior, you want to praise that. Okay? Usually Koreans are not very good at acknowledging good behavior. We are very better at telling what they're doing. So in this case, we have to do because we have to do the person role model, right? Okay, so if they're doing something that really do the job, so be that person, good job. Okay? Or acknowledge that. So attention, praise, reactions, encouragement. So you want, if he's doing something good, you want him to keep doing it more. And also privileges, activities, choice, toys, rewards, works. Sometimes some children might enjoy sensory. Some children don't even care if you give it reward, but they might respond to the sensory. So if you know a little bit about the child, you might want to do something that he would really enjoy it rather than same for everybody. And also, if there's something that a child doesn't like, try to avoid that, whatever is possible. Sometimes you have to teach and it's something that you have to do and there's no other choice. In that case, I recommend doing it gradually, kind of, like, um, this is, like, for example, like children will have hard time going to like crowded places like restaurant, and the parents take it there and has a behavior meltdown, everybody has a bad experience, they never go back, right? So in this case, what I tell them is just go there and just maybe stay 5-10 minutes. Don't pretend that don't try to stay there for the whole time to eat, but for him to get used to that shortly, right? And then you go back and do it for 10-15 minutes or 30 minutes. So build things that you have to do gradually if it's something that he has to learn. But if it's something that really he's having a meltdown and there's no reason for you to expose to that, try to avoid it. And one of the students have, like he's in high school, has autism, and every time he goes to a class, we have problem. And before that, he had a recess, and we didn't know why he have problem, in that period. And because at the end, after all this, I was like looking carefully, because he didn't like something about that class. That's when he was having meltdown. But because he doesn't talk, people don't know why he was having behavior. So sometimes kind of you have to do a little bit of searching. And one of the principles of behavior therapy is ABC. It's, like B is behavior, right? That has a meltdown or has something practice, and you have to be consistent until he learns the rule. But if you keep changing, he doesn't. It's unpredictable. It's going to be very hard. Um, yeah, I think it basically is positive role modeling and patience. And also, ignoring is very powerful. So we want to ignore the bad behavior, whatever is possible. If the child is hurting other child, we cannot ignore it. You have to stop, and then you can use timeout or separate, right? Or separate the child from the rest. But for things that is kind of making noise, or things that is kind of annoying but not really impacting others, if you want that to decrease, just pretend that it's not happening. Because once there's no reinforcement of that behavior, that tends to decrease. Or you want to change to something else. If it's doing something like making noise, you can distract. Okay, let's do something else. And then you distract. You start from that behavior and you give different activities so he can focus and do it. Let's see. And I think what is important is to tell other students that typically developing children, they are very sensitive and they know that child is different, and sometimes they bully, and sometimes they are more sensitive than us. But I found that if we explain to them, all right, we're all different, and let's say Johnny is different, and he might not learn the way we do, and he might not communicate the way we do, and he might do things differently. But we are all different, so we all have our differences. So let's help him be part of the group. So if teachers kind of prep the group, and instead of them getting annoyed, they might even help you. And when the whole team works, that's when you can see more improvement. I think teachers prepping the rest, so it's like someone who has problem alone, they don't see it, but when there's others around, that's when the problem starts. But when the surrounding is more protective or provide buffer for their behavior, and kind of they're more tolerant of certain behavior rather than getting annoyed and make it more of an issue, that child is protected and their social skill might improve too. So, if it's really severe, like there are therapists that can analyze, but that's not the role of the church. And also, I'm thinking that most children that comes to like church or classroom setting, they are somewhat higher functioning than those who are really nonverbal and they're really delayed. So those higher functioning, with a little bit of help, they can catch and learn to be social. Okay, this is doesn't, it's simple, like getting mad doesn't help. Try to call when they're really having a meltdown. They don't listen, so you have to leave them alone. Or if you keep repeating warnings, right? But without any consequence, they're not gonna stop. Okay, any other question?
Dr. Park, I have a question. If sometimes we have students or younger children who come to our church in our younger department, and sometimes our pastors or teachers are not aware that they might be autistic, and they throw tantrum and they may act up or in the form of maybe kicking and so on, and sometimes we don't know what to do. Whether should we touch the child, should we restrain the child, and so in moments like that, should we intervene and keep the child from hurting himself or herself or and others? So from a medical perspective, is that because sometimes we don't know what to do, what advice would you give in that circumstance?
So it's hard when you don't know if the child has autism.
Thank you so much.
Such a great audience, and I'm so used to people asking questions. More like Q&A type, so thank you.
Thank you, Dr. Park. We need to move right along. We're going to take a 5-minute break before Grace Cho Jipsanim is going to give us the learner's perspective. But before we go on a break, we need to take a picture. Hyun News are on us to produce a picture of Hyun News. So can everybody come forward, face that way? We're going to take a very quick picture, and then we can take a 3-minute, 4-minute break, and then we're going to be back. And then